Okay, good morning, class. This lecture is going to be very quick one, and it's going to be on pharynx. Um, we've talked about uh, the the larynx. We've talked about the palate, and now we want to talk about the pharynx. Well, uh, the pharynx is actually or commonly known as the throat, and we know that it's about I think 12 to 14 centimeter, and yes, 12 to 14 centimeter or 5 inch long. Um, uh, it has three regions, as you can see in this picture. It has a nasal area. It has a place called the nasopharynx, and then the oropharynx. And actually, this is based on its anterior relation. For example, the nasopharynx is actually posterior to the nasal cavity. The oropharynx is posterior to the oral cavity, and of course, the laryngopharynx is posterior to the larynx. And what does the pharynx do? It actually helps the passage of substance from the nose and the mouth. Okay, so we'll say it has a dual function. Number one, in digestive system and also in respiratory system. Also, the muscles that are found there help in facilitating peristalsis together with swallowing and also speaking when you consider the longitudinal muscles. Now, there are muscles in the larynx, also called the laryngeal muscles, and there are six of them actually, and they are divided into two groups. Now, before I talk about these groups of laryngeal muscles, it is important to note that all of them act on the pharynx, either by constricting or elevating it. And they also, like I mentioned earlier, they also help to push the food bolus towards the esophagus and during swallowing, either by contracting or by shortening the pharynx. So some of the muscles also helps in speaking. Now, talking about the pharyngeal muscles, there are we divided into two groups. One is the pharyngeal constrictors. So we're talking about constrictors. We're talking about the superior constrictor, the middle constrictor, and the yes, the inferior constrictor, the middle constrictor, and of course the superior constrictor. Now, the superior constrictor actually originates from the pterygoid hamulus, the pterygomandibular raphe, and the posterior end of the mylohyoid line of the mandible, and goes ahead to insert to the pharyngeal tubercle on the basilar part of the occipital bone. Now, when you look at the middle constrictor, this one originates from the stylohyoid ligament, okay, the stylohyoid ligament, greater and lesser horn of the hyoid bone, and then it goes ahead to insert at the median pharyngeal raphe, and also it also blends with the superior and the inferior pharyngeal constrictor. Then talking about the inferior constrictor, this one originates from the oblique line of the thyroid cartilage, also known as the thyropharyngeal part. Okay, the pharyngeal the thyropharyngeal part also originates from the cricoid cartilage, also known as um, the cricopharyngeal part. Then it inserts at the median pharyngeal raphe, which but not all part of it. It only inserts at the thyropharyngeal part. Then it blends inferiorly with the circular esophageal fibers. Also talking about the cricopharyngeal part. Then we have longitudinal muscles. Okay, these muscles here are the longitudinal muscles. Okay, you can see the longitudinal muscles here. Okay, so the first one is the palatopharyngeus muscle. This one originates from the posterior border of the hard palate and palatine aponeurosis, and goes ahead to insert at the posterior border of the thyroid cartilage, and then also it blends with the contralateral palatopharyngeal muscle, so it blends with it. Then talking about the second longitudinal muscle, longitudinal pharyngeal muscle, we have the salpingopharyngeus. This salpingopharyngeus, actually from the look of things, also originate from the inferior cartilaginous part of the auditory tube, also known as the eustachian tube. Then, of course, goes ahead to insert. Well, it blends with the palatopharyngeus muscle, so it blends with the palatopharyngeus muscle also. Then we have the stylopharyngeus. The stylopharyngeus is actually different. Okay, in fact, even the nerve supply is different. Why the vagus nerve? Okay, don't worry, we'll get to that. The stylopharyngeus muscle actually originate from the medial base of the styloid process of the temporal bone, which you can see. Then it blends with the pharyngeal constrictors, then the lateral glottic fold, and the posterior border of the the thyroid cartilage. Actually, the thyroid cartilage. Then talking about the arterial supply. Well, the arterial supply of the pharynx actually comes from three major arteries, and that is the facial artery, the lingual artery, then of course the maxillary artery. And of course, from our knowledge, we'll remember that these three arteries actually originate from the external carotid artery. Okay, that's about that. Then talking about the venous drainage, the vein actually drains via the external palatine vein, and of course that one also drains to the pharyngeal plexus, which then empties into the internal jugular vein. Okay, so empties into the internal jugular vein. Then talking about the innervation. Okay, this was what I was talking about. The innervation of actually the pharynx gets its innervation from the pharyngeal nervous plexus, and majorly from three nerves, cranial nerves. The first one is the vagus nerve. The vagus nerve actually provides motor, motor innervation to all the structures and muscles of the pharynx, except the stylopharyngeus. If you remember, if I can go back here, the stylopharyngeus, when I was telling you that it's actually different in terms of innervation. Okay, so in terms of innervation, it is actually innervated by the glossopharyngia. Now, the glossopharyngia, it is actually it supplies the stylopharyngeus. Okay, then it provides majority of the pharynx with sensory innervation. So, which means, in other words, it is actually sensory to all to the pharynx. Then the vagus is motor to the pharynx, except to the stylopharyngeus, which is supplied by the glossopharyngeal nerve. Then we have the maxillary nerve, which actually supplies the anterior and superior part of the nasopharynx. Okay, so here we talked about the pharyngeal branch of the glossopharyngia, the pharyngeal branch of the vagus nerve, and of course, like I said, it's all from the pharyngeal nervous plexus. So remember this: the vagus nerve is motor to all the muscles of the pharynx except the stylopharyngeus, which is supplied by the glossopharyngeus muscle nerve, and also the glossopharyngeus nerve. The glossopharyngeal nerve is sensory to majority of the pharynx. Okay, except I think I remember, except the nasopharynx. It does not supply the nasopharynx. Okay, what supplies the nasopharynx is the maxillary nerve, which is of course supplies the anterior and the superior part of the nasopharynx. Okay, I think this is it. Okay, 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 this is not correctly placed. Okay, so you can see that the pharyngeal branch of the glossopharyngeal and the pharyngeal branch of the the vagus nerve. Thank you very much.